Bronchial asthma. Introduction. Asthma is described as a chronic obstructive inflammatory disease consisting of a cellular component, which results in the inflammation of airways and hyperresponsiveness in response to some direct or indirect stimuli. Pathophysiology. In patients with asthma, the physiologic mechanism changes due to inflammation, decreasing the radius of the airway. This changes the compliance of the lungs slightly to increase the work of breathing. Signs and symptoms. The various signs and symptoms associated with asthmatic attacks are coughing, especially at night, during exercise, and laughing. Wheezing, whistling, or squeaky sound in chest while breathing, especially when exhaling. Shortness of breath. Tightness in chest. Pain and pressure in chest. Triggers. The symptoms of asthma may be triggered by exposure to certain allergens, such as weeds, pollen, pets, dust, mites, or due to the presence of some irritants in air, such as smoke, chemical irritants, or certain odors, or due to some extreme weather conditions, or the presence of sulfites in certain foodstuffs. Certain conditions, like respiratory illness, exercise, and flu, makes a person more susceptible to asthmatic attack. Triggers. A strong display of certain emotions, such as shouting, crying, laughing, may sometimes also contribute towards asthmatic attack. Breathing patterns associated with strong emotions can lead to the constriction of bronchial tubes, provoking or worsening of an attack. Asthma, like other chronic conditions, leads to emotional stress. Types. Depending on the age and the factors involved, asthma can be classified as childhood asthma, adult-onset asthma, exercise-induced asthma, cough-induced asthma, occupational asthma, nocturnal asthma, and steroid-resistant asthma. Diagnostic tests. Tests must determine expiratory airflow limitation, documentation of reversible obstruction, and rule out any alternative diagnosis. Assessing the patient's obstruction via spirometry and checking for a reversible change after a bronchodilator is suggestive for the diagnosis of asthma. By using spirometry, physicians can diagnose asthma as well as the severity of obstruction. Spirometry. The definition of the obstruction of air is spirometry of FEV1 less than 0.8, and the FEV1 by FVC ratio is less than 0.70. Demonstration of airways obstruction and its reversibility greater than 12% and 200 milliliter increase in FEV1 following inhalation of a bronchodilator is recommended to confirm the clinical diagnosis of asthma. Stages of asthma. There are 4 stages regarding the severity of asthma: intermittent, mild persistent, moderate persistent, and severe persistent. Stages of asthma. Intermittent asthma occurs when one has symptoms less than 2 days a week and nighttime awakenings less than 2 times a month. Mild persistent asthma consists of having episodes more than 2 days a week, but not daily, while there are nighttime awakenings of 3 to 4 times a month. Moderate persistent asthma is where the patient is symptomatic daily and has nighttime awakenings greater than once a week, but not nightly. Severe persistent asthma is where a patient is symptomatic throughout the day and often has nighttime awakenings more than 7 times within a week. Medications. The most common medications used are short-acting beta agonists, long-acting beta agonists, muscarinic antagonists, and inhaled and systemic glucocorticoids. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.